Hello everyone, this is Sarah Velasquez and I'm an intake manager at GSHC Surrogacy Agency. I'm also an experienced surrogate, just started my third journey. So today I'm going to be talking about estrogen injections, which is one of the many medications that you as a potential surrogate will be on during your journey. The importance of estrogen is to thicken your lining to the perfect thickness that will be optimal for your embryo transfer. So as you start your medications, you'll be taking, if you're prescribed this medication, anywhere from every 3 days to every 2 days, again depending on your doctor's protocol, to get your uterus lining to that perfect thickness for embryo transfer. So it's very important that you take this at the same time, every time, no matter what. So I'm going to go through and show you how I do my estrogen injections. So first things first, make sure we wash your hands. I like to use hand sanitizer afterwards. You're going to need 2 alcohol prep pads. One is going to be to clean off the vial of your estrogen medication. So you'll actually go clean off the top of it. Your second pad is going to clean off the area of your skin that you're going to do the injection. So to give you a quick reference point, I like to put my pants to right above my crack area, and I use that as a linear point. So as you can see, it makes it an easy line here. So you want to grab this piece of meat on this side or this piece over here. And this is a good area to inject your medication. So now that I picked my side, I'm going to get my alcohol prep pad. And the way I do it myself is I poke my hip out, I twist myself, and you can actually see the area that you're going to want to inject. It's very important to do the alcohol cleaning first, because if you inject yourself while the area is still wet with alcohol, it burns very, very, very badly. So always let that dry while you start prepping your medication. So you're going to be given a syringe. Take your syringe out, pull the plunger, make sure it's working. Then you'll be given 2 needles. One will be an 18 gauge needle, one will be a 22.5 gauge needle. Remember, the larger gauge needle, the smaller the needle. The smaller the number, the larger the needle. Large needle is to withdraw the medication, small needle is to inject it. Please do not mix it up because it is very painful. So I'm taking out my 18 gauge, attaching it to my syringe, the cap off, withdraw air into the syringe. Do it a couple times just to make sure that the plunger doesn't get stuck or anything. You're going to get your del estrogen and you're going to inject. I like to go in sideways, that way there's no scare of me stabbing myself. I've seen some surrogates going like this, I've seen some going like that, whatever your comfort level. So you're going to fill the vial with air, move the needle down, and then you withdraw your prescribed amount of medication. I'm prescribed 0.2 milliliters of del estrogen, so I'm going to withdraw to the 0.2 mark. When you go to recap your needle, all you do is just slide it in on the table, like that. Hold it from the side, your needle's recapped. Never push down like this or like this, because you can actually stab yourself. So twist off. Make sure to drop all used syringes and needles into your sharp container and not the trash can. Now you get your smaller needle. So same thing, it twist on, pull the cap off, flick to get the air bubbles up, push gently until you see a drop of the medication come out. So now it's time to inject. And here's the shot. 1, 2, 3. All the way in, all the way out. And then that's it. Easy peasy. So after the shot, I like to kind of do a deep massage into the area. It helps disperse the medication and it'll keep you from getting any lumps. Another good tip is before you inject is actually rub the vial in between your hands to warm up the liquid, and that will also make it easier to inject. And that's how you do your del estrogen shot. I hope you guys got a lot of good information. Leave comments or questions below in the comment section. See you later.